Hello, good evening. My name is Dr.Chudi Ufundu, and it's that time of the week when we have an opportunity to review important topics. So it's Weekend Open Clinic with Dr. Chudi, and the name of our organization is Inspirations Global Health Solutions. Thank you and welcome. The topic today is very interesting for so many reasons. Most times we talk about women, the role women play in starting the family. We do talk about men, but we don't talk about men to a greater extent. So this afternoon, we'll have opportunity to talk about men. And we're going to talk about men from the perspective of age. Can a man be too old to be a father? Do we have the male equivalent of menopause? What's the effect of age to a man towards becoming a father? Do we have similarities with what happens to women? What's the major difference between age in a woman and age in a man? What is the farthest a man can go to become pregnant? These are the things we're going to provide you feedbacks to this afternoon. It's going to be amazing. So please, if you're participating, I need you to introduce yourself and tell us where you're located, indicate if you're a man or a woman. It's important to understand that this might be a game changer in your family because there are so many things we blame women for. But these are the things that we should understand collectively. The difference between you succeeding and not succeeding is knowledge, attitude, and practice. So by the end of this presentation, my aim is to help you to understand better the role of age in a man and how far a man can go, what age has to do with becoming pregnant and becoming a father. Very, very important. So please, if you have a moment, please introduce yourself and we're going to get started. Remember to register for the event coming up on the 30th. Our masterclass is going to be on gynecological disorders. So there are a couple of gynecological disorders that might actually be the reason why you're not a mother today. On the 30th of this month, which is a Sunday, by 9 p.m. Nigerian time, we'll find convenient time to talk about that. So make sure you register today. But let's talk about today's topic. How old is too old for a man to become a father? Do we have a cutoff point? What's the role of age in a man? What's the equivalent of menopause in a man? Is it really the same thing with women? Now, for women, old age is associated with mood swings, hot flashes, pain, mood lability, and a couple of other things. That's very unique to women because of hormonal changes. At the center of these changes is actually one powerful hormone we call estrogen. Women are who they are today because of estrogen. When you're getting older, the level of your estrogen will keep dropping up to the point that it will flip the other two important hormones, follicular stimulating hormone and luteinizing hormone. So as you're getting older, when you get to age 35, the level of estrogen in your body will diminish. And when this happens, there will be an increase in the level of follicular stimulating hormone, which is the other opposite end of the spectrum. So yes, men do go through the equivalent of menopause in women, but it's not exactly the same. Women are terminal. So women are terminal in regards to reproductive ability. A woman has a specific number of years to have all her kids. Once those number of years are elapsed, she can no longer become pregnant and have her kids by herself because she's no longer able to ovulate. This is not the same thing with men. Men can have some changes, which we call andropause. So andropause is the equivalent of menopause in men, but it's not exactly what happens in women. So andropause actually refers to different hormonal changes that happen later in men. So it's all about the symptoms that men experience when their testosterone level starts dropping. So the same way estrogen is dropping for women, as you're getting older, your testosterone will drop, especially when you get to age 40. Every man in our community today, by the time you get to age 40, we will notice a decline in the level of your testosterone. And testosterone is what drives you as a man. Testosterone plays a lot of role in your ability to become a father. Now, there are a couple of other medications and lifestyle that will also lead to decrease in your testosterone level. So this is why lifestyle modification is very important. So andropause is more commonly clinically referred to testosterone deficiency. So anywhere you see andropause in a man, we're actually thinking about the level of testosterone. So it can be called testosterone deficiency, or it can be called androgen deficiency or hypogonadism. They are the same thing. Now, it's important to note that how andropause presents in men, it's not the same thing with women. When a woman goes into menopause, she can no longer have eggs. Her eggs are depleted. When a man is going to andropause, he can still produce sperm. He can still be a father. Now, the oldest age for a father out there is 92. 92. So age can affect the quality and the fertility, but age is not terminal when it comes to men. So a man in his 60s can still get a woman pregnant. A man in his 70s can still get a woman pregnant. A man in his 80s can still get a woman pregnant. A man in the 90s can still get a woman pregnant. But here's the deal. The quality of that sperm, it's not the same thing compared to when he's young. But it's still possible that the sperm can get a woman pregnant. So the quality will be affected, but the effect itself, it's still there. Compared to women, when you go into menopause, when you have not released an egg, when you have not bled for 12 consecutive months, you have gone into menopause until proven otherwise. Now, what are the likely symptoms that men will have as they're getting older when their testosterone level is low? That's when they are in this so-called andropause. What are the commoner symptoms men will present with? So as you continue to age, which everybody's going to age, nobody can escape aging. Aging is a beautiful thing. So as you continue to age, it's normal to start experiencing physical, sexual, emotional, psychological changes when your testosterone is dropping. It might interest you to notice that as a man, there are some days you're depressed. There are some days you don't even feel like talking to anybody. There are some days you're moody. There are some days you're irritable. When we check your testosterone level, when your testosterone level is low, testosterone level can drag you down if it's low. Testosterone level can lead to depression in a man, especially if your lifestyle is not helping you to overcome. So there are a couple of presentations that men that have testosterone issues based on andropause will present. Number one is low sex drive. Majority of them will no longer have libido. Majority of them will have erectile dysfunction. Majority of them will be completely detached. They will be easily tired. They will have fatigue. They will have reduced muscle mass. This is why when you see all these men, if they are not engaging in exercise, they tend to have flabby body. Most men about this stage, if they have reduction in their testosterone, will have mood swings and irritability. And some of them might develop depression. Now, while all these symptoms associated with andropause can be overwhelming, you can flip them. You can manage the symptoms by the time you modify your lifestyle. So there are a couple of things you can do, especially regarding what you eat. So if you eat balanced diet, rich in essential nutrients and your vitamins, you can regain back your vitality. If you engage in regular physical activity, it will help you. If you get at least 7 hours sleep daily, it will help you. If you manage your stress level, it will help you. So in as much as you might not be able to have interest in making love with your partner, when you eventually make love and you control your lifestyle, you can still get that woman pregnant. This is the difference. So men can still impregnate women way into the 90s. As opposite of women that once they go into menopause, they no longer have eggs. So for you to become pregnant, if you've gone into menopause, you will need to use another person's egg. So women begin to experience the drop in their fertility by 35. Now, in men, in as much as the quality of the sperm will be affected over time, but you can still impregnate a woman. So older fathers will have a higher possibility of infertility and higher possibility of having babies that will have birth defects, but they can still become fathers. So because we don't have the same biological clock like women, you need to know this. It's important to make sure you wait and make sure that the partner you have is the right person. Now, there are a couple of options. So if you know fully well you want to be somebody and you haven't found who you want to start your family with, you can go for freezing the sperm. So we can collect very highly preserved quality sperm and we can freeze it. We can freeze it for as long as possible. Then when you see your partner, we can use that sperm we froze to start your family. Now, we also know that there is no evidence that freezing sperm is important for you to start planning your family, but it's an option out there. So in a nutshell, in as much as your fertility might be reduced as you're getting older as a man, you do not have the same effect that menopause will have in women. You can still become a father, even as old as 90. It depends on your individual constitutional factors. So yes, age can affect how soon you can become, but age is not terminal for men. So that's my presentation. I'm going to open the clinic now, and I'll give you an opportunity to ask your questions. So please feel free and ask your questions. Immediately after this clinic, I'm going to run a repeat clinic in Facebook. If you're not able to participate through our YouTube, don't worry. If today is the first day attending my YouTube presentation, please make sure you subscribe. Just click on that subscription button. Make sure you set your notification because I come live every Saturdays and every Tuesdays. But right now, please, if you have any questions, quickly ask so we can get the clinic discussion started. Ask your questions, please. This is a live clinic. So I'm live, so you can ask me questions directly and I will give you feedbacks in real time. Do you have any questions? I can see Chinyere. Chinyere, do you have any questions? Though it's showing me no one is in the clinic now, so I don't know if it's technical problems or what. But it's okay. I'm going to hang around and spend a few more minutes to give you an opportunity to ask your questions. So if you have any, feel free and ask before I transition to Facebook. Do you have any questions? All right, just to summarize, age, yes, can affect your fertility, both for the females and the males. But the effect of age on women is entirely different from the effect of age on men. Age can reduce the quality of the sperm, the quantity of the sperm, but it will not lead to complete, reduction completely. Though some men can present with azoospermia. But in women, when you get to that terminal phase of menopause, you no longer have eggs, so you can no longer become pregnant. But men can be going through andropause and still be productive. If 35 is the benchmark for women's age quality to reduce, what's the age bracket for men? By default, when you get to 40, like I mentioned, when you get to 40, there are a couple of changes in your body because of that reduction in testosterone. So men will start experiencing the same presentation I had, but the difference, a man might be in andropause, which is pretty much reduction in the testosterone, which will present with all the symptoms I mentioned. But if he continues to have regular lovemaking with a woman, he can still get a woman pregnant. But for women, when you enter menopause, no possibility of pregnancy again. Naturally, you can by help. So that's the big difference. So the age bracket for men, when we begin to see manifestation of effect in fertility, is from 40 years up. So in women, it's from 35. So for some reason, God keeps giving men a lot of advantages. Okay, can exercise stop women from having hot flushes during onset of menopause? Now, there are certain things that are standard by nature. No one can stop menopause, and menopause can present differently for different women. Now, the reason why you're having all these hot flushes is because of the fluctuation in the level of your estrogen. So by default, anything that will naturally improve your mood and the natural ability to produce estrogen can mitigate. But there is nothing that will instantly stop that feeling. So some women will have hot flushes. Some other women will not have that. Now, an alternative is to give you estrogen supplementation, which, we're very careful in introducing any hormonal-related drugs lately because some of them can predispose you to developing cancer. So menopause is a natural thing. It's not a disease. Just like pregnancy is not a disease. Just like menses is not a disease. Just like ovulation is not a disease. So at some point, as a woman, you go into retirement. So that hot flushes, what we normally do is to see how we can improve those symptoms. So some women can notice mood swings, extreme mood swings, depression, sleep problem, night sweats, irregular period, when they are going through this transition. So the difference between andropause and menopause. Women are going to principally go three phases. So one is pre-menopause. The other one is post-menopause. Then perimenopause. So peri means about that period of 4 to 10 years before you eventually enter menopause. Premenopause means before menopause, and postmenopause means after menopause. Now, the only time for a woman that if she doesn't get support and, kind of professional support, that she will not be able to become pregnant between these two phases. A woman can become pregnant pre-menopause. A woman can become pregnant perimenopause. But once a woman enters postmenopause and is confirmed she has gone into menopause, pregnancy is practically impossible. Is there something a woman can do to increase estrogen level? Definitely. Lifestyle modification, drink a lot of water, eat a lot of fruits and vegetables, avoid stress, watch your body weight. Anything that improves the general way your body functions will also improve your natural hormones. So if you live healthy, you keep an eye on your food, your weight, you sleep, you avoid stress, by default, even if you have little quantity of estrogen remaining, there will be useful estrogen. So lifestyle modification will definitely help you in that regards. Beautiful question, Chi. Please keep bringing them up. How true is the saying that reduction in estrogen might predispose women to UTI? Now, directly, no. Indirectly, maybe to an extent, because what happens? What's the role of estrogen in the body of a woman? Estrogen is pretty much what makes you a woman. Estrogen is the reason why if you desire your partner, you will be wet and you will be ready to receive the penis. Now, when the level is reducing, there will be possibility you will start having dry vagina. Now, dry vagina, it's more prone to getting infection compared to a vagina that has some fluid there. So in course of sexual intercourse, a woman that has dry vagina, besides experiencing pain, can have sores during sexual intercourse. And anytime you have any opening sores during sexual intercourse, that might be a portal for infection, including UTI, including STD, and what have you. So indirectly, not directly. I love that question. Do we have any other question? Let's round up by 20 minutes. I love the questions, Chi. So please keep bouncing off a couple of more questions if you have any. Join me in Facebook immediately after this so we can continue the conversation. Okay? If you have any other questions, Chi, please feel free and ask. I love all your questions. Very technical, very clinically oriented, and I love them. I love tough questions so we can, pieces it together and you understand it better. So please, if that's all, then we're going to round up. But if you still have any, feel free and ask before I go. This is a very important topic. Unfortunately, only 2 people attended. Any more questions? So Chinyere, if we don't have any more questions, I'm going to wait for your signal. Once you signal, we're okay, we're going to end the clinic. So give me a signal if we're done. Are we good? Okay. So thank you so much for coming. Chinyere, I don't know if you're available, but please join me in Facebook almost. Let's take about 10 minutes break, then I'll go to Facebook and we'll round up for the weekend. Thank you so much. Remember to join me tomorrow. Remember to register for the masterclass. Remember to get a subscription if you live in Nigeria and you need help. I'll see you guys in Facebook. Thank you so much for coming. Bye-bye for now.